Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Last question though, how can I know if my son has autism or PANDAS? His symptoms have always been present but get much, much more worse when he is exposed to strep. I got him evaluated twice. The first time I was told to take parenting classes to address concerns of tantrums, social anxiety, rigidity. They are, the person asking the question is a BCBA and have been using ABA with him since he was about a year old. The second time the evaluator did not seem to be as qualified. He felt he was too borderline to get a diagnosis of autism and instead gave him a diagnosis of anxiety. He was separately evaluated by a PANDAS pediatrician who diagnosed him with PANDAS, despite his blood work coming back normal. How would I know if I should continue with ABA or treat this medically, or maybe both? Is there a way to clearly differentiate if the symptoms have always been present?
Yeah, what a wonderful question, brilliant question. PANDAS for our viewers is, let's see if I get this right, pediatric autoimmune neurological dysfunction associated with strep. That should spell out PANDAS.
You're impressive.
Like you know, the thing with PANDAS, Shannon, that was really interesting for me, obviously I was in the world of autism since the 70s. And then one day, but I'm also a licensed clinical psychologist, so I took a lot of continuing education courses over the years, and I was sitting in a continuing ed course, and I was always very interested in like medical side of things. So this was like, I think it was, you know, the neurobiology of the brain or something like that. And the person giving the lecture began describing PANDAS. And I had never heard of that before. It was like I would say this class was maybe in the late 90s or so. And I suddenly woke up, because like these 8-hour continuing ed courses, you're doing a bunch of other stuff too, right? So then I suddenly woke up and I was like, they just described autism. That was very interesting. So the symptoms that you often see with PANDAS are very similar to autism in the sense that there's a lot of the same obsessiveness, a lot of the same ritualistic types of behaviors. There are delays that are very similar. And so, you know, and our viewers, you all know, we don't really know right now. We don't have a set etiology to autism. We don't say, oh, this is what causes autism, right? There's lots of different theories. There's lots of publications on what it could be, couldn't be. The predominant, I guess, field now believes that it has to do with toxicity, and look at PANDAS as being one of many possible causes. That's the way that I look at it. So in other words, a child may have been exposed to a strep infection early on, and it's altered their brain functioning in a way that altered their learning, and it resembles very much the symptoms of autism. There are other disabilities or disorders, also genetic disorders that resemble autism very much and could actually be part of autism, is what I'm saying. So kids with PANDAS could be part of the whole spectrum of autism. Kids with Angelman's could be part of the whole spectrum. There are many other things as well. So it doesn't matter. If I were you, what I would do is I would definitely try to treat the PANDAS, because that's not going to be harmful to your child. And just in case, I would like to, you know, like make sure, maybe see another physician who is a specialist in PANDAS. But at the same time, you know, do the things you would do to strengthen your child. So give them ABA, teach them skills, get them going on language, get them going on all the things that they need help with. Just like any neurotypical child would receive tutoring for some area that they need help with.
Amen to that. We are out of time. We went a little bit over because we started a little bit late, but I just want to say I thank you so much for everything. Anytime I leave my house and go someplace and I see things in the world, I'm reminded of how much better my life is because of the work that you do and who you are.
Thank you.
So I felt that very poignantly this week. So I'm so glad that you guys have an opportunity to be here with us. We have lots of interesting things going on here, not the least of which is getting our studio together. But tomorrow on the show, an amazing guest for the first time on Autism Live. We're having Mary Barbara on, has an amazing podcast of her own, is a BCBA, and can't wait to talk with her about the things that she is doing because there's a lot of people out there who need a whole lot of help. So we're part of trying to make that happen. So make sure that you tune in tomorrow for that show. We'll be back then. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
Bye, everyone.
If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time on autismnetwork.com. We hope to see you there.